Rob, you look pretty happy.
It's Friday.
Yeah, just 2 more days to the work week.
Every day is a work day.
Okay, everyone should be allowed to record.
Good afternoon, everyone, and thank you for joining us. My name is Chip Partner, Assistant VP for Communications at University of Rochester Medical Center. We're delighted to be joined today by Dr. Robert Mayo, the Chief Medical Officer of Rochester Regional Health, and I'm with Dr. Michael Apostolakis, the Chief Medical Officer for URMC. Jennifer, does everyone have recording privileges?
Everyone that's been enabled should have recording privileges. If not, please let me know.
Thank you. I think Dr. Apostolakis will open with a short statement. We've got some pretty good news to share today. Then Dr. Mayo and then Veronica will moderate the questioning.
Thanks, Chip, and thank you, media, for being here today to share this news. I'm happy to join Dr. Mayo today to share some very encouraging news. The post-holiday spike in COVID cases has subsided. As of this morning, there are 126 COVID positive patients at Strong and 46 at Highland. Those numbers are less than half the COVID hospitalizations we saw at peak levels in mid-January. Our hospitals remain very busy, but we will be able to resume limited visitation at Strong Memorial Hospital and Highland Hospitals beginning Monday, February 15th. This is great news for our patients, their loved ones, and for our doctors and nurses. As caregivers, we know how seeing family and friends helps our patients' well-being and convalescence. The visitation guidelines are slightly different for each hospital. At Strong Memorial, they are similar to what we had in place last fall. Patients can designate up to 2 adult visitors, with 1 person allowed to visit each day for up to 4 hours. There are exceptions for patients at Golisano Children's Hospitals, mothers giving birth, and others with special needs. Visitors will be screened when they arrive and required to wear masks at all times in the hospital. People who have symptoms or have tested for COVID positive will not be allowed to visit. Strong's emergency department has insufficient space to maintain social distancing. So unfortunately, we must continue 0 visitation in the ED and a few other crowded units. I'll ask the media to please make clear that 0 visitation rules remain in effect this weekend at both Strong and Highland hospitals. Limited visitation resumes Monday, February 15th, and details will be prominently posted on each hospital's website. I should also note that registration process takes time, and our reception areas will get backed up if everyone arrives at visiting hours begin. If you can plan to visit at other times during the day, you'll be less likely to wait in line. We've seen the number of COVID cases drop because people are masking, socially distancing, and following good hand hygiene. I'm grateful to the community for supporting our hospitals by following these practices. Let's all stick with it in the coming months and look forward to the widespread availability of vaccines that will put an end to this pandemic. Thank you, and I'll hand it over to Dr. Mayo.
Thank you, Dr. Apostolakis. It's a pleasure to be here with you as usual. And I want to begin by thanking our healthcare heroes, our community members, everyone who has lifted a hand to help us through this pandemic. It's been a huge community effort, and that effort continues, and it will need to continue. But part of the reason we are beginning to see the significant reduction in the COVID cases is because of the collective work that we've done. So I'm so pleased to see this change, and I hope that everyone in the community will recognize the value of our collective work in getting us here. Rochester Regional Health will also be able to open up limited visitation beginning next week on Tuesday. We're pleased that Rochester General Hospital and Unity Hospital within Monroe County have seen a major reduction in their total COVID cases, as well as the number of serious life-threatening COVID cases requiring ICU level of care. So because of those improvements in the COVID case volumes, we will invite visitors to visit their loved ones on a similar basis that we also used last fall and in the summer. So the nature of these visitation criteria is posted on our website, so you can easily see it there. But similar to Strong, we will be following the guidelines from the Department of Health. These guidelines include one visitor at a time, maximum hours of 4 hours a day. Each patient may select 2 different individuals who could visit independently. There will be certain and necessary exceptions in the maternity units, in the pediatric units, where support individuals may be present on a continuous basis. For patients who are sadly facing end-of-life scenarios, we also permit additional visitors with support of desired clergy. Our emergency departments, because of their crowded environment, will also be restricting visitation. So that's important for you to be aware of, that an emergency room visit will delay visitation. And if that patient is later admitted to the hospital, then visitation can begin. So please check our websites. We look forward to having you as guests in our facilities and commit to doing what we can to supporting you and your loved ones. Thanks so much.
Thank you, Dr. Mayo. And before I turn it over to Veronica, I have to thank Morgan and Will, our translators, for providing ASL translation in Dr. A's office today. And Veronica, I think you were going to moderate the questions for us.
Yep, and I'll give you guys really quick an order of what I have. It'll go Noel, Andrew, Brian, Wendy, Emily, and Dan. So let's start with Noel, followed by Andrew.
Okay, thank you so much. So for my first question, I'm wondering what would be the indicator that you would need to stop these limited visitations, and any expectation that it might come to that in the coming months?
Well, once again, it'll depend on hospital census, an increasing percentage of positivity in the community, and concerns that we would have to shut down programs such as ambulatory surgery or ambulatory visits would prompt us to go back to the restricted visitation.
And Noel, did you also mean conversely that these restricted visits could end permitting more open visits if things continue to improve? It could go either way, right?
Exactly, yeah. If you wanted to speak to that, Dr. Mayo.
Yeah, sure. And I certainly concur with everything Dr. Apostolakis has said on this. And similarly, we will continue to keep the press and the community apprised of the evolving pandemic numbers and the patient loads in the hospital. And we hope that if this trend continues, that in the next month or two, we'll even have more visitation. That will be yet to be seen, but it should be an encouraging spring for us all.
Okay, thank you. For my follow-up question, I'm wondering if you have any message for families of patients, particularly patients either needing longer-term care, hospice, or even maternity wards.
Well, it's important that you communicate with your nurse and physician so that you can coordinate the necessary visitation. And then, as Dr. Apostolakis explained, there will be screening at the doorways as there was previously. So we need to ensure that visitors are well
the state has given the hospitals is a supply that they believe you will need to vaccinate your 1A employees. Each week, we tell them how many 1A employees we believe will need the vaccine that week, and they tailor their supply to that number. They've directed the health departments and their own state mass vaccination centers to really focus on 1B employees and also patients. And that's why our messaging has changed. Initially, we thought that we were going to receive directly vaccine for our patients, but it's become clear that the state wishes us to focus on our 1A employees, and that's what we've been doing. But they have been giving us enough vaccine to take care of our dwindling number of 1A employees who still need it.
Yeah, Rochester Regional Health has also had enough vaccine for its employees, but as the approach from the state has changed over time, we have received the message that the vaccine for the general public will be administered through other means, not through the health systems. So it is important for our patients to not wait for a phone call from us as we initially thought we would do. So if we have extra vaccine, we can and do share it with our patients and with the public. But that's a very small number at this point. So I encourage all of our patients in the community to do their utmost to sign up for vaccine through the distribution points, such as our pharmacy partners in the community. Pharmacies are carrying it, as well as the Monroe County site at the convention center and the state site at the Dome Center. So do your best to work those scheduling processes to get your vaccine.
And I was wondering if, I believe, if I understand the process, this is outside of your control, but looking at as UV's now visitation for hospitals, what is your expectation or your hope for we might see that for nursing homes? And are you involved in any of those discussions? Obviously, you both have nursing homes under your purview with your institutions.
The visitation requirements for nursing homes are more stringent than they are for hospitals. And that's appropriate based on the vulnerability of that patient population and the significant amount of suffering that has been observed there. So at this point, we don't expect to see those regulations change. They certainly might, but at this point, they've been the same. And there has been no local flexibility to adapt them the way there has been for the hospital visitation process. So presently, we are sharing all that information with our residents' families on how to be tested so they can visit and how to manage visitation, and our nursing homes post when they can accept visitors and when they are closed to visitors. And that does change at times from week to week.
Yeah, I have nothing to add to that answer.
Okay, Wendy and then Emily. Wendy, you're muted.
Sorry. Hi there. I wanted to follow up on that, if that's okay, Dr. Mayo. I had a question in regards to the nursing homes. I know that RRH oversees a number of nursing facilities. There is a lot happening right now with questions about transparency and honesty at the state level. And as you know, families have been asking to be let in to see their relatives. You were saying that there isn't flexibility at the local level. If there were to be flexibility at the local level, would you support visitation for families?
So I don't have all of the specific regulations right here about that. We could certainly prepare for another another conversation about that. But the state requires that there be a certain number of COVID-free days of residents as well as employees before visitors can come into a nursing home. And so those are the key criteria. And when they're met, then families and friends can come and visit residents if they've had a negative COVID test in the preceding days. And there's also a certain set point on the window of time that you need to be tested and be negative. So at this point, that has been a effective way to help us control COVID spread within nursing homes. And I know that it's been difficult, and there have been times where residents have been separated from their families for extended periods of time. So we want to do all that we can to help people, work through that and get through that and get to their family and friends as soon as possible. So we've been really compliant with those requirements and have, I think, helped folks through that.
So can I ask you both to comment on this request for essential caregivers? Because I think it also goes over into the hospitals. And I know Dr. Apostolakis, I've spoken with you about this before, and the importance of having an essential caregiver. You just said that you just commented a little bit about how it's helpful to have visitors at the hospital, a family who can help participate in that process and be there to be part of the team. These families, for the families who have relatives in nursing homes, have been requesting for many, many months to have an essential caregiver who would be able to be with their loved one, following all of the same guidelines as an employee. And I wanted to get your thoughts on that, because they're concerned about their loved ones dying from failure to thrive.
Right. It's a great question, Wendy. And my heart goes out for patients and families in nursing homes during this time. I can speak for the hospitals in that when we allow essential workers or caregivers that patients need at home, we have a number of different areas that can screen these workers, that can take their temperature, and that can regularly check in on them. And I believe it's easier for hospitals to assure proper screening, and that patients, workers that help them aren't carrying the virus and can't transmit the virus. I can't speak for the nursing homes, and so I don't know what their ability is to screen these workers and these persons coming in. And I do believe with what's happened, out of an abundance of caution, the state government is trying to protect those patients. Now, you're right. It's on one side we're trying to protect the patients and the staff from someone bringing in COVID, and on the other hand, there is some non-COVID harm by not allowing people to come in and help nurture and care for their loved ones. It's a difficult question, and I'm not sure there's one easy answer.
Do you have any comment on that, Dr. Mayo?
Yeah, I also sympathize and recognize the challenge that this poses all around for residents and their families and loved ones. And I just encourage you to do the best that you can with electronic communications. And I know that our nursing home employees are doing their best as well to support residents and families through this.
Thank you.
Okay, Emily and then Leah.
Good afternoon, doctors. Thank you for taking the time to talk with us today. So back to hospital visitations. I'm curious, can patients change who their designated visitors are? Like, for example, if they want 2 people designated one day, are they allowed to then pick 2 different people the next day?
at Rochester Regional Hospitals, that they can. Yes, they can.
At URMC, we request that they choose 2 for the duration of the hospitalization, remembering that most hospitalizations are about 5 days long. But if there are special circumstances where families need to have more than the 2 designated visitors, we do take that on a case-by-case basis and try to be as liberal as we can to allow the visitors that need to see their loved ones.
Thank you. And a quick follow-up. If someone is interested in visiting a loved one in the hospital, but they're not sure if they are one of those designated visitors, maybe they can't get in touch with their loved one or their loved one isn't able to communicate for whatever reason, how can they check if they are one of those designated visitors?
At URMC, we keep a log at the front information desk. So we would ask for the family members to check at the front information desk for the log of who's been designated as the 2 visitors.
It's a similar process in Rochester Regional Hospitals as well.
Excellent, thank you.
And Leah or someone from Channel 8? Maybe not. Okay, I think we're good, Chip.
All right. Thank you, everybody, for joining us today. Thanks to Dr. Pastelakis, Dr. Mayo, and everyone in the media for helping us get the word out. And special thanks to Barb Ficara and Jennifer Friday on my team for setting this up, and Morgan and Will for providing the translation. I think we can end the meeting here and get everyone out by 1 o'clock. Thanks.
Thank you, everyone.
Bye.